Hi, everybody. I'm Dr. Bill Curry. I'm a general internist here at UAB. I work in primary care and population health work. I'm also a past president of the Medical Association. We're here at the UAB Drive-Thru testing site for the community. We also test some of our employees and other special populations here. And we're going to show you that in just a moment. I want to remind you about the criteria for testing, at least as it stands today. You can always check this on the CDC website. But it is that somebody is symptomatic with symptoms that could be COVID-19 and that they have some high-risk category like heart failure, chronic lung disease, diabetes, immunosuppression, things of that sort, age over 65, and especially maybe if they're a healthcare worker or first responder. The reason to be special about that is that there's such a scarcity of testing supplies. So I want to remind you of that and always check that. We'd love to test everybody, but we can't do that right now. Maybe at some point we can. Now I want to introduce my partner in the UAB testing enterprise here, Jordan DeMoss, who's one of our administrators and has done a superb job of pulling a team together that has planned and operationalized this great testing site. I'm going to start by asking Jordan a question, which is, Jordan, why do drive-through testing as opposed to doing this in a clinic or out on the breezeway or something?
Our main goal of a drive-through is really to limit exposure, really for everyone, the patient and our staff, as we really try to figure out who is positive and who isn't so we can get the right treatment options. So our goals here are really about safety, efficiency, and getting access to the community for testing. It's so important to us to provide that access all across our community, and the drive-through site really helps us do that in a safe way and in an accessible way. We have really three main stations. Our first is a check-in station, and there's a ton of work that goes on behind the scenes. So as a patient calls our call center and we screen them to have an appointment made, we're also collecting important information that then helps us with the process here to be efficient. So as they drive up, we've got them already registered and have pre-printed labels for them ready to go. So it's a quick check-in process to validate who they are, to make sure we have the right patient, and then we send them on through. And there are really two other main things that happen. They get an assessment by one of our providers, so our nurse practitioners are here on site to make sure that they're well enough to continue on. Our biggest fear is that someone shows up and needs medical attention more quickly, and so we have providers on site who are ready to provide that care. If they are well enough, we allow them to go on down the hill and to be swabbed and tested. And the whole process is very efficient and takes usually less than 5 minutes to complete. We've received a lot of positive feedback, and we're very proud of that. Our team at UAB here has put so much time and effort in a very short amount of time to really make it work well. And to automate as much of it as possible. So there's very little paper out here. It's a very automated process. And most of all, it's a safe process. So we used simulation and our expertise in our simulation center to make sure every part of this process works. And really so that it works for our patients that come here who already have anxiety and are worried about themselves. We don't want this process to be even more anxiety creating. So it has been a huge success, and it's attributable to so many people who have made it happen. I think the biggest thing is to really take the time to map the process. Even though we're working quickly in this crisis, we're also taking the time to make sure the processes are in place, again, to ensure safety as a top priority, but then also efficiency. And then second, really to be mindful that when you set up a process, make sure it's scalable, so that you're not duplicating resources. PPE is in limited supply, as well as testing supplies. So we really want to maximize and optimize what we set up so that we're not wasting those supplies in our community. Well, I appreciate the support of all the area hospitals and Jefferson County Department of Health. This is really, while it's a UAB-sponsored site, this was the vision of community healthcare leaders in partnership with JCDH. And there's been a lot of effort behind the scenes to make this site successful. So we're proud that UAB could sponsor it, but appreciate the support of the community, because the goal here was really to create access for our community to testing at a time when there was very limited resources. I think there are some really important things to take into account when you're setting up a site related to scale with our limited resources. I would say that at minimum, this is a personal opinion, that really 50 per day is really where I would start as far as making it worth the investment in the PPE. Scaling this has been something we've talked about over the past few weeks, and we've learned that we can do triple the capacity even in our short hours of operation here. So, I think once you have someone suited up in PPE, you really want to maximize that resource. So my opinion is at least 50 per day is what I would advise. We are here as a resource to the state. We're happy to help. We're happy to talk about what works and what doesn't as far as our site. And again, I think the more communities can partner together, the healthcare communities across the state, and do this together, the more efficient we'll be and the less resources we'll use to get the same outcome.